Hello and welcome to YHTV's nominated show, Magical Medical Tour. This is episode 83. Thank you for joining us today. I'm Christina Suzama, and with me is our wonderful medical guide, Dr. Glenn Woolman. Good day to you, Dr. Woolman.
And a very wonderful day to you, Christina, and to all of our guests. Greetings, everybody. Welcome to Magical Medical Tour. I'm Dr. Glenn Woolman. I will be your host along with Christina today as we travel through another quadrant of the healthcare galaxy, searching for optimal health. I'm very excited today, Christina. We have a guest with us, Kabir Southwick, who is an Ayurvedic and naturopathic practitioner, and we're going to speak about the ancient healing system of Ayurveda. I've been waiting to do this for a long time. But before we do that, in case anybody has questions or wants to get in touch with us for comments, how about telling them how to do that?
Sounds great. Now, at any time during this live presentation, you can feel free to ask a question or make a comment simply by scrolling down on your screen and typing it into the comment box. Or if you prefer, you are very welcome to call into our conference line at 323-476-3997. And your ID is 607-393#. And if that went by a little too fast, not to worry. Those numbers will show up on your screen during this live presentation. Thank you, Glenn.
You're welcome, Christina. And speaking of thank yous, I wanted to take one moment to thank all of the people that voted for us and voted a number of times for us in our potential quest for what is it called? The Podcast Award.
It's the Podcast Awards, that's right. The 9th Annual Podcast Awards.
I was trying to think of an Emmy or a Grammy or a potty or a... It's not maybe, a potty, is it?
Maybe one day they'll have one of those for these online IPTV awards. That's what it'd be.
Yeah, it'll be a potty.
A potty.
Maybe not. Anyway, thank you, everybody, for all of your votes. We're so appreciative of all that you did for us. And we hope to continue doing the good work that got us nominated. So today, we're going to be speaking with Kabir Southwick. He's a professional health consultant. He's an Ayurvedic and naturopathic practitioner. He's a whole foods nutritionist, an herbalist and formulator. He speaks publicly on natural self-care, and he's an author. So welcome, Kabir.
Hello, Kabir.
Thank you. Thank you for having me here today.
Thank you for honoring us in our community.
Yeah, definitely. Kabir, usually as the medical guide, I like to tell our audience where we might be going today. So at first, we're going to start to learn a little bit about you and what got you interested in all of the things you do and the journey you've come on to get to this point. And then we want to really get into Ayurveda a little bit so that people will have an understanding of it. And we'll talk about different parts of the practice, and maybe we'll cover a few of the other things that you do in your life and practice. How does that sound to you?
Sounds good. Look forward to it.
Excellent. So let's start right away with your history. What influenced you? When did it happen? What were the things that grabbed you to become a healer?
Well, my family was involved with Hatha Yoga, and I was raised as a lacto-vegetarian and was taught Hatha Yoga and Pranayama at an early age by my parents, and the time that they spent in ashrams and yoga camps during my youth. And my mother was a nutritionist, so she was teaching me about combining amino acids and digestion, using foods as vitamins, like brewer's yeast, blackstrap molasses, cod liver oil. And these things I was taking as a child and had a great interest in nutrition due to the influences of my mother. And at an early age, I began studying Western herbalism. I mean, in my teens, I was selling and mixing teas. Then in 1982, I went to India at the request of my mother, who had also spent some time in India because she worked for the United Nations. And there I discovered the Indians were the true masters of understanding diet, food, natural health care. So at that point, I focused my studies on Ayurveda.
That's a good introduction. So now let's talk about what is Ayurveda.
Well, that's a very vast subject. Ayurveda, I believe, the most ancient of all the healing sciences. It's believed that even Chinese medicine was initially influenced by movements of people from the Indian continent over Tibet into China. So Ayurveda can be traced back up to 5,000 years ago, and much of the written text that is studied today is still 2,000 or 3,000 years old. So this is a healing science that has not just the oldest science, but the one that has endured the longest and continues to gain popularity. Initially, it was an oral tradition passed down from teacher to student, and it was only for after a couple thousand years was it written. And of course, the roots mean Ayu, life, and Veda, knowledge. So it is much broader than just healthcare. Ayurveda is a very broad category, and by no means myself or any one person could say that they are a master of Ayurveda or practice Ayurveda in a broad sense. Everyone is specialized in a certain aspect of Ayurveda. Even Hatha Yoga, Pranayama are all considered aspects of Ayurveda. And Ayurveda is really the science of living life. So the areas that I studied, of course, are dietary, understanding a person's digestive system type or body type, or prakriti, and identifying the most suitable foods for that individual body type to improve their digestion. And second is the mixing of herbal powders or churnas. These are the areas that I specialized in. But of course, Ayurveda is, even in the healthcare realm, is much broader. There's a panchakarma, which is another section of Ayurveda in itself, of complete detoxification. That includes oil therapy, purge, and other types of therapies that are done. This is not an area that I specialized in. I specialize in dietary guidelines, particularly the digestive system, and mixing herbal churnas or herbal powdered formulas. Ayurveda likes to use powders over teas. So I provide both Western teas and Ayurvedic powders to my clients.
Kabir, what do you think it was that gave such insight to the continent in India in terms of health at that point in time?
Well, I believe Ayurveda comes from southern India and the state of Kerala, and this is a jungle area, quite dense, and they have a wide variety of plants, herbs, and bark that you wouldn't find, say, in a desert environment or a forest. So they were blessed with this very dense source to work from. And over thousands of years, through trial and error and through observation of animals, apparently, they learned the effects of herbs and food and spices, which for Ayurveda is all one and the same. It's only here in the West where we differentiate between herbs and food. We see them as separate, but in Ayurveda, they're not really separate. So this is how Ayurveda accumulated, or let's say the early practitioners accumulated this knowledge over generations and generations and passed it down So I believe that the knowledge of herbs and even the knowledge of foods is one of the greatest achievements of humankind, because it has taken thousands of years to determine the effects and actions and properties of millions of parts of plants: the bark, the stem, the leaves, the roots, the flowers, the seeds, and how they affect the human being physically, mentally, emotionally.
Seems pretty interesting and complex. When when an Ayurvedic practitioner sees a patient, what's the process at that point? In Western medicine, we sit down with a patient, we take a history, we do a physical examination, we order laboratory tests and visual imaging studies. What would one expect if we went to see an Ayurvedic practitioner for a health problem?
Well, in Ayurveda, it is the interpreting of the body, interpreting the skin, the texture of the skin, the dryness, the moisture of the skin, any markings on the skin, the face. The tongue is very important for understanding the intestinal tract, the reading of the tongue, the lips, the nails, and of course the pulse. From the pulse, almost all ailments or imbalances can be detected. So it's really the art of interpreting and reading the signs that the body has and is displaying, that are there for everyone to see. It's just having the ability to interpret it and translate this into a type of knowledge that allows the Ayurvedic practitioner to see imbalances.
It always interests me the similarities in traditional Asian medicine and Ayurvedic in terms of pulse and tongue diagnosis. Mm-hmm. And I always find it interesting and think about, in Western medicine, the thing we do most with the tongue is put a tongue blade over it so we could look around it and past it. And very rarely do we use the tongue for our own diagnostic purposes unless somebody comes in with a problem because of the tongue. When you are seeing someone, how long does it take for you to see them on a normal visit, a first time?
Well, it depends on how much information I have in advance. If I have advanced information and they've completed a health intake form and I've had an opportunity to speak to them on the phone, I could be quite prepared when they come. Already have pre-made herbal formulas and prepared, and then I could work with them quite quickly in less than an hour. However, if I haven't had a previous contact or communication or much information, which of course is quite common, people are often reluctant to complete a lot of paperwork in advance, and then it can take longer, hour and a half, even up to 2 hours. Some people are, I wouldn't say complex, but they're more difficult to read, or we have conflicting signals and information that doesn't leave me clear on the imbalances in the person's body and what my priorities would be.
What would your priorities be at that point?
Well, generally,
especially if you're not clear.
Well, most of my priorities are quite simple. If people come to me with almost any type of acute or chronic condition, whether it would have been weight issues or anxiety or even a tumor or a growth, generally I start with what I call the preliminary necessities of health. And this is proper bowel movements. It's very important in Ayurveda that there are proper bowel movements. Most people, of course, believe their bowel movements are normal. You ask many people, how are your bowel movements? And they say, normal. Normal for me. But in fact, most people are not having healthy bowel movements, a healthy elimination, which of course is reflective of incomplete digestion. And with incomplete digestion, we won't have sufficient absorption of nutrients. Then, of course, we won't have vitality and health, which can result in a chronic degenerative condition or even just fatigue or nutritional deficiencies. So generally, starting with these basics is very, very important. And people are often surprised because they come to me with very serious health conditions, and I'm focusing on their bowel movements, their sleep, maybe even helping to reduce the stress during the day, trying to improve eating habits, moving them away from snacking and irregular eating into whole meals, trying to improve their sleeping habits to be more consistent, either getting up earlier in the morning or sleeping a little bit more or not staying up as late, not eating at night. These are all lifestyle habits that create havoc for the body that needs to remain in harmony and is in its own circadian cycles. And by eating irregular, sleeping irregular, this affects the body's own ability to detoxify itself during the evenings and digest properly during the day. So generally, I focus on digestion, elimination, sleep, lifestyle habits, eating habits first. And what I say, I kind of clean up the situation first, so I have the person sleeping good and pooping good, and then we can move forward.
Yeah, that seems pretty good. We talk about that in what we do with our 6 areas of life for life balance, 6 categories, and certainly you've covered a number of those. When in Western medicine, somebody comes to us with a sore throat, and we give, if it's an appropriate diagnosis, bacterial, we'll give them an antibiotic for a certain amount of time. And sometimes we don't follow up with them if we assume that they get better, otherwise they'll come and see us. In your practice, do you follow up with people once you give them an herb? When's the next time you see them?
Yeah, well, of course, in this manner of self-care, because really it's the person caring for themselves. I'm only the guide to understand their body, their health condition, their imbalances, and helping them prioritize what needs to be worked on first. But it's the individual themselves that has to make the lifestyle changes, improve the diet, and take the herbs and drink the tea, not myself. So, of course, I'm very concerned that the person is following these guidelines, and I encourage them. And we're moving from step to step, working on some of these preliminary health concerns that I mentioned, and then moving forward step at a time. And they're seeing their health improve in other ways. Often when I work with a client, they come with a particular ailment or disease or imbalance, but after I've improved their digestion, improved their eating habits, improved their elimination, improved their diet, that what they came to me for, whether it was headache or menopause symptoms, have already fallen to the wayside before that I've actually got around to addressing them directly. So generally, I address the health holistically, knowing that ultimately the body wants to heal itself. The body is always working for its own best interest. And if I can help the person or the body to have what it needs, what it's lacking, often what it's craving. Cravings are often a sign of deficiency, and if they can be interpreted and understood, then the person can supply the body we could say on a nutritional level, but more than that, what it needs, and then secondly, help the body to rid what it doesn't need. Of course, congestion, toxicity, phlegm, excess mucus, sometimes excess stomach acids. And so then when the body has what it needs and is helped to eliminate what it doesn't need, many health conditions improve before I ever come around to having to address them directly. But that's usually my first approach, is to help the body as much as I can over a period of time, and this could be anywhere from a couple of weeks to a few months. And then if the initial health condition still remains, or then we will continue to focus on that. And of course, some things like weight will always take time. Any type of cysts or fibroid or tumor, this will also take time and will need to be addressed individually. But many issues will improve by themselves because the body will heal itself. And many of the conditions that people see as diseases are only the tip of the iceberg or a symptom to a deeper imbalance, which is what Ayurveda is looking for and working on.
I know that you, as a practitioner, are always looking for the root cause analysis. And in Western medicine, we're always looking for that too. And our way of looking for that is usually through a microscope or testing cellular levels of things, or testing levels, say, of a vitamin or different parts of the body's chemistry. How does an Ayurvedic practitioner look for a root cause? And is it the same kind of thing that Western medicine is looking for?
Yeah, well, I'm not so sure whether Western medicine really does look for the root causes. I would know better than myself, being that I've never been to a Western doctor except for my friendship with you and other medical practitioners. But Ayurveda is looking at deep, what we could call imbalances. So, for example, you may have a person who has anxiety, and the Western doctor may look for certain deficiencies. But in Ayurveda, they can see at a deeper overall imbalance in the person that can be reflective in being underweight, having dry skin, having a jumpiness, a lack of calmness, and maybe even short in fat and oil, and a hectic lifestyle, which are all still evident of this deeper imbalance of dryness, overactivity, overstimulation. And this can be seen in the body, particularly of the thin, underweight, restless, and overly active person, both mentally and physically. So this imbalance could be identified even on the telephone. And this particular imbalance, in Ayurvedic terms, would be a vata imbalance, which means air, which is things are moving too quickly, too active. This type of person with this imbalance, they may be calling about anxiety, but it's for sure that they will have difficulties sleeping. There'll be a lot of excess thinking, and they'll also have a dry skin and often constipation. So once the root imbalance is seen, then there's other symptoms or signs that are a result. And by asking the person, do you also have this symptom? And they go, yes. And do you also have this? And they go, yes. How did you know? Because now you're looking at the deeper imbalance. Now that I know I'm seeing the deeper imbalance here, because I'm telling them other symptoms that they have before they tell me. So now I can feel that I understand this imbalance.
You mentioned vata, and I know that this comes in with the body types that the Ayurvedic practitioners look at. Would you explain to our viewers, and maybe even spell out each of the words so that if they wanted to look these things up, they could do that? Would you explain the body types and how that influences your diagnosis and treatment?
Now, this is an aspect of healthcare of Ayurveda. It's called we could say the theory of the three doshas. The doshas are the three body types, or we could say your constitution, the constitution type. And the three main types are vata, pitta, and kapha. And there are subcategories. There's actually 9 different categories as well. There's besides
Kabir,
three.
would you spell those, please?
Oh, Vata, Vata, which means air, movement. and then Pitta, Pitta, which is fire and transformation, and then Kapha, Kapha, which means earth and water, and which means cohesion and forming and growth. So it's easiest to think of the three overall body types. And in Ayurveda, there's no one size fits all. And this is what I noticed when I first went to India in 1982 after studying traditional nutritional sciences in the West, after the influence of my mother, is that in Ayurveda, they don't have a one size fits all. They don't say that a person should have this or another, or this is good or this is bad. Truly, they follow the principle of one man's food can be another man's poison, the Hippocrates quote. And this is very, very important to Ayurveda, to understand the person's fundamental dosha or body type or body constitution type initially. So instead of looking at the complex subcategories, we'll just focus on the three main ones, Vata, Pitta, and Kapha. So, and you can imagine this type of person in your life. So try to imagine this person, and I'll describe these in their dominant sense. Now, many people, of course, instead of just a Vata, they could be a Vata Kapha, they could be a Vata Pitta, and of course, they could have been born a Vata, and now they could have an imbalance and have excess weight and be a Vata Kapha. So there's variations, but the three main ones, Vata, Pitta, Kapha, are as such. The Vata is the thin person, thin even in older age. They don't put on weight very easily. They tend to have a dry skin. They tend to have a lot of anxiety or activity. They get up early in the morning, clean the whole house, do a lot of errands, got a lot of energy in the morning. Then they become a little tired in the afternoon, often have difficulty sleeping. They're restless, think a lot, and tend towards constipation and have a very sensitive digestive system where they'll say many things will give them gas and bloating in particular in the colon area. So you can imagine this a skinny, active person that's very busy and thinking a lot. I think we all have this type of person in our life, and we know them. They're out there. We call them Vata, Vata types. Now the second type is the Pitta. Pitta is the Greeks would call the mesomorph. They're more muscular. They're stronger. They're often still thin, but they're not skinny. They're more upper body strength, stronger features. But the main distinct quality of the Pitta type person is their warmer body temperature. They're hotter, they're warmer, they're wearing tank tops while other people are wearing jackets. Children will throw their blankets off, not want to wear jackets despite their parents continually being concerned about them, because their body temperature is literally warmer than other people, and they are running warm. And so this is their distinct feature. They also are very driven people, very motivated people, very intense people, and their digestive problems are usually more to do with the stomach, too much stomach acids, heartburn, acid reflux, indigestion, or sometimes a high blood pressure. So there's all certain imbalances that are inherent in each of the different types. The third type is the Kapha body type. The Kapha body type is the one that puts on the weight most. It's just the stocky person or the voluptuous shaped woman, or often the people we see with weight issues who are very overweight are Kapha types. And so in Ayurveda, we wouldn't call a person overweight. We would say they have a Kapha imbalance. And this is a way of basically saying they have too much weight, too much growth. So, and this person tends to be clammy and cool and calm and slow, and their problems generally are imbalances are generally related to overeating, being too sedentary, not being active enough, and leads often to diabetes, blood sugar issues, cholesterol, obesity. And this is the path that they can go when they're extremely imbalanced. So once you have this grip on what type of body that you're dealing with, it's like a mechanic knowing what kind of car he's working on. If somebody calls about their car and says their air conditioner isn't working, well, the first thing the mechanic wants to know is what kind of car do you have? And if you say, oh, I have a Camry, and he may say, oh, those Camrys, they always have trouble with the air conditioner. Well, this is the way the Ayurvedic practitioner is working. He's knowing the body type. Once he knows the body type, he's saying, oh, I bet you have trouble sleeping. Oh, I bet you have a little anxiety. I bet you think a lot at night. And the person goes, yeah, how'd you know? That's because we now know the body type. So it's like the mechanic knowing the common problems with that particular model car. It gives him a great advantage. If you had three people in the room, cooking, say you had three women in the room cooking, the one running around doing most of the work, the busybody, that would be the vata. The one who is maybe being more bossy and dominant would be the pitta. And the one sitting at the table slowly cutting the potatoes, talking a lot, but not working as much would be the kapha. So you can see these people in your life, and for an Ayurvedic practitioner, generally we can identify this type of body type even before they come, just through the conversation. And this allows us to know their imbalances without them having to tell us. And it allows us to prepare the diet that's going to be most suitable for that person's digestive system type. Because actually, the dosha, what you're born with is called the prakriti. You have one that you're born with, and then you have one that you are now, the vikriti. So you could have been born skinny, but now if you're overweight, then you have a kapha imbalance. But you are still that skinny person deep inside. So if I know a person was born a vata, but now they're 30 pounds overweight, I can be sure that I'll be successful to bring them back to their natural state. But if I have a person who was always overweight, always struggling with weight, even in the youth, even in their teenage years, they had extra weight, then I can know that they're never going to be a skinny person. At best, we're going to bring them down to a healthy weight. So it also gives me a frame of reference to know where we can go. What is the person's natural state, as well as what their imbalances are. And for digestion, this is essential. And this is a big mistake that modern nutritional science makes with their one-size-fits-all approach. I'll give you a very good example. We know that cayenne and chili and pungent vegetables, we could say, are helpful in the stimulating a fat metabolism in the body, stimulating circulation in the heart, and helping with weight loss. But if you have a person who's a pitta, who has a warmer body temperature, gets acid reflux and heartburn, you're not going to, if you told them to have chili pepper to lose weight, they're going to tell you there's no way I'm going to have chili pepper. Every time I have chili pepper, I get heartburn and acid reflux. But as an Ayurvedic practitioner, we would say, well, I'm not going to have you do chili pepper because that would obviously give you heartburn and acid reflux. And they go, that's right. Same for, say, fighting a fungal infection or yeast infection. We know that garlic is very effective. But if you have this pitta type person who you would, without even asking them, you would not tell him to be having garlic and raw garlic all day, even if he had a fungal infection, because this would only aggravate his tendency. Doesn't mean he has it, but he knows that he has a tendency to get acid reflux and heartburn, and more than likely does not like garlic, onions, and spicy food. So once you know their body type, then the whole diet becomes clear. Any herbal formulas that I prepare are adjusted for that individual. This is why many of my clients have met each other in the streets and to their astonishment found out that they had a completely different diet. I've had clients who were overweight and they both lost 30, 40 pounds. And then they met each other on the street and they compared notes. And they found out that they thought their diet was the perfect weight loss diet because it worked so well for them. But when they met their friend, they realized that I gave them completely different foods and a completely different routine, and that person lost weight. So both people were very surprised, and I've had this happen many times where people approach me when they met my other clients and ask me, how come you told that person to have apple cider vinegar, but you told me to have lemon juice? And I go, well, I wouldn't tell you to have apple cider vinegar no matter how healthy it is, because vinegar is very acidic. You have strong stomach acids, and you have tendency towards heartburn and acid reflux, and you do not like vinegar, I believe. And they go, that's right. So that's why I didn't even mention it, because I knew you. I didn't have to say, can you take apple cider vinegar? I just said, no, you have lime with your water. Don't use apple cider vinegar. So this is due to the knowledge that you have of that particular body type.
Now, can I be a hybrid?
Yes, in fact, most people are not fall clearly in those categories. Most people fall in subcategories, like I mentioned, Vata Pitta, Vata Kapha, Kapha Pitta, Kapha Vata. These are subcategories, and there's even tridoshic. And of course, Ayurveda takes in more considerations than just your body type. It's very sophisticated. It also takes in your current health condition and your current state. There's what's your natural state, your prakriti, and then there is your current state. And then also the consideration is is the weather, the seasons. Ayurveda is very much geared to the seasons. So if you have, for example, a cold person, a Vata person who has cold hands and feet, they're getting very cold, they're getting very dry, they have dry skin, they have dry stools, and they're so during the winter time, we would tell them you must follow your Vata diet very carefully, or your Vata pacifying diet, and have all warm foods, all cooked foods, to balance out the environmental effects of the winter, because the Vata person is cold and dry, and the winter is also cold and dry. So this is not a good time for the Vata person. So they need to make more effort to find balance. And in this, to balance coldness, of course, they would have more warm and cooked and heating and pungent foods. And to counterbalance dryness, they would have more liquid, moist soup type of meals, and avoid dried fruit, dried crackers, dried rice crackers, dried substances, which would only further increase their imbalance of dryness.
I want to talk about medications for a minute and herbs, and compare in Western medicine and in Ayurvedic medicine. You obviously do not use Western medications, and you supplement that, or you change that for herbs and teas and powders and different foods, natural foods. When a person has a chronic disease, say hypertension, they're probably going to be on a medication for the rest of their life, unless there's a specific reason for the hypertension or high blood pressure. Is the same thing with Ayurvedic medicine? If somebody is a chronic hypertensive person and they don't want to take Western medicine, you may put them on an herb. Will they be on that herb for a short amount of time, or for the rest of their life possibly also?
Yeah, there's many people who do require long-term consumption of the herbs to keep themselves balanced for the rest of their lives. But of course, these are just plants, leaves, stems, barks, and there's no problem. Just think of a simple issue like sleep. Those who have insomnia, of course, there's different levels of not being able to get to sleep, not being able to stay asleep, or not sleeping deeply. There's different types of insomnia in Ayurvedic terms. And herbs can help either in those three areas to help to relax the person, to allow them to stop thinking, or they can be taking sedatives to help actually get them to sleep, and then they can be taking some herbs to help keep them asleep. And these can generally be used for long periods of time. There's some purgatives and laxative herbs that are not recommended for long periods of time, but they still are often better than not having bowel movements. So many people have, I've been drinking certain teas for 30 years and haven't stopped. I have an energy tea every single morning instead of a cup of coffee to get me going. And this has a ginseng in it, and ginkgo and other stimulating herbs to get my brain going and get my heart pumping and get me moving in the morning without having to resort to coffee or caffeinated products. And there's no harm in these. These are a balancing. Herb can only kind of push you in a certain direction. If it can help you become a little sleepy, it can help a certain system in your body. But very few of them are not recommended for long-term use.
Okay. When we have a medication in this country, the two things that we usually know about a medication are, one, that it's relatively pure, unless something gets contaminated in a batch, but it's relatively pure. And also we know a dosage. There's been, the FDA has talked about certain herbs and drugs coming out of India and China that were heavy in heavy metals, mercuries and leads and arsenics, number of things. How do you, in your practice, and how do other Ayurvedic practitioners in this country look for purity and in dosages for your clients and patients?
Well, quality is the name of the game with herbalism. And this is why many people don't have the results that they should with herbal formulas, because the quality was too poor. Most of the herbs that you buy in the supermarket or department store, or often in the health food store, have been on the shelf too long. They are not of the highest quality, and this will not produce often the desired effect. And of course, the source is critical. And a lot of the Ayurvedic herbs now that particularly practitioners in the United States are purchasing are from the United States. And because of the concerns of sourcing these products overseas, particularly China has been a great concern for many years, and to a lesser degree, India. But now these channels of suppliers in the United States and the rest of the world that have been certified as organic and not using pesticides and have been tested. These channels have already been well established in the last 10 or 15 years. 20 years ago, it was very difficult, and many of the herbs I had shipped directly from India. Not so today. Many of these can be found through suppliers in the United States that have been tested them, or many of the herbs are now being grown even in the United States, where quality can be assured. So it's not the same issue that it once was. As far as quantity, each person must work with the quantity. I believe many people have an allopathic approach sometimes to taking herbs, where they're just taking it to solve a particular symptom, but also they tend to want to take just a pill or a capsule or 1 cup of tea and expect to have the same results, when in fact they often have to increase the quantity. For a cardiovascular condition with somebody who need to thin out their blood, they may have to drink 4 or 5 cups of tea a day to keep their blood thin throughout the day. And 1 cup of tea will not do it. And with many of the herbal powders to sleep or to have a bowel movement in the morning or to reduce anxiety, so one person may need a half a teaspoon. Well, another person may need 2 or 3 teaspoons. So most of the time, the client is slowly increasing the quantity and adjusting the quantity to fit them. But of course, I always try to make an adjustment in that individual. If you have a person with lower body weight, they're obviously going to need less of quantity. Some people are very sensitive and they may need less. And other people with a more body weight and more dense type of body may need larger doses. So this is all adjusted, again, based on many factors.
When you, one of the things that I see and hear and frustrates me often is people are always talking to each other, and somebody hears about, oh, the chamomile tea is good for calming your stomach, so they go out and buy some chamomile tea, or they hear that this herb is good for this particular problem, and they'll go to a store and pick some up. They may talk to the person at the counter and say, which is your best of this or that. What's your advice to people that, I guess in a way, this is self-treating? What's your advice to people like that?
Well, a person can always, learn in that manner. I mean, as a youth in my teens, I was always taking herbs to see the effects, and I still will take herbs sometime in large quantities to understand and experience the effects. But if you have a health condition that you're concerned about, it's particularly a serious, life-threatening health condition, then you really need to work with somebody who can formulate these herbs for you. There's many misunderstandings about herbal remedies. One, like you mentioned, people say, well, chamomile is good for relaxing the intestinal tract or helping you sleep. But in fact, no herbalist really gives out a single herb. They're never really prescribed in a single manner. Like we have people here in this country who are taking turmeric in capsule form. This would be hilarious in India that anybody would be taking turmeric in a capsule form for inflammation or other type of condition that we know turmeric can be helpful for. They're always in a formula, and often with a multiple herbs, and not only are they in a formula, the vehicle in which they're taken is important. Many herbs for the liver, for example, are taken with ghee or honey because we want to reach the fatty cells of the liver. Many herbs that are for the pancreas or blood sugar stabilization are actually taken with honey because they want to stimulate the pancreas and have some insulin released, so this herb is pushed into the tissue and absorbed as sugar, along with the sugar of the herb. So, and then other herbs, say for somebody who is has acid reflux or heartburn, they may take their herbs in aloe vera. Is very common, that pitta type. So for some herbs, it could be, say, I want to fight a fungal infection or bacterial infection. Well, the herbs are very strong, the Oregon grape root, barberry, Paul de Arco. But if I prepare them and have the person take them in aloe vera, then this will balance out these effects. And of course, aloe vera is actually antifungal and antibacterial as well. So it would still support the cause, the action, but it would balance out the irritating effects that these herbs could have on the person's intestinal tract. So it's not just the herb, but it's the formulation. And then the formulation needs to be adjusted for the person. For a certain person, you could add carminative herbs in there, like cumin, coriander, dill. For certain individuals who are heavy, overweight, poor circulation, you could add in other stimulating herbs such as black pepper, mustard seed, cayenne, which would further be stimulating for that individual. And then the vehicle in which they are taken in, whether it's in tea, whether it's in powder form, whether it's in aloe vera, whether it's in honey, or whether it's mixed in oil. This will then direct it to the certain part of the body, certain system, certain organ. So it's not as simple as just taking chamomile.
Clearly. And And this brings up the next question. How does one find an herbalist or an Ayurvedic practitioner, and how does one determine whether or not that should be the one that they go to?
Well, I don't know if I could answer that, but you need to find herbalists are everywhere, and you really have different schools. You have a Western herbalism, which is influenced by the traditions here in North America and Europe, and this is a Western herbs. Generally, if you know 300 or 400 Western herbs, you can be quite a good Western herbalist, and they are quite common throughout the country. Of course, the Native Americans also have contributed greatly to Western herbalism, and there's many good Native American herbalists in this country as well. And there are a few around the country that I've communicated with, and we exchange formulas. And this is what herbalists are looking for, is other herbalist formulas and which ones have produced good results for them. So you really want to choose which school you want to follow. The Western herbalism is probably the most simplest, and it's the newest. It's only been around 1,000 years or so, from the Greeks and the Romans. And then there's Chinese. Chinese is quite broad as well, like Ayurveda, and intricate, and takes more years to understand. I never studied traditional Chinese medicine. I use some Chinese herbs that I really like astragalus, and of course ginseng, and Schizanderberry, and other ones that I particularly like, and I don't find similar herbs in Western or Ayurvedic medicine. And then there's Ayurvedic medicine. I think Ayurveda approach is more individualized than the other systems. They adjust more for the differences in the individual, and that's what really gives them the strength. And that's what many of my clients say. They say, "Well, I went to this other herbalist, and and as soon as I took the herbs, I got, my constipation became worse. And then when I take your herbs for the heart condition, my constipation got better." Well, that's because I added herbs in there to help to move the bowels, even though you came to me looking for herbs to lower blood pressure. But I knew you were constipated, so I added these herbs in to as a secondary action to help with that condition being so important. And then I also add in a carminative herbs to help with the digestion, which I mentioned earlier. So there's different layers of an herbal formula: the first action, the second action, and maybe some digestive herbs as well that need to be adjusted for that individual. So I think Ayurveda is, in its strength is its ability to adjust for the different types, different body types. Not to say that Chinese medicine doesn't do it as well, but it's to a different degree, in a different manner, and not quite as refined as Ayurveda. Chinese medicine, of course, is in some sense more broad. There's acupuncture, which is in Ayurveda, and also Chinese medicine will use different animal parts, chicken feet and blood and other aspects that Ayurveda doesn't use. So you want to really pick the school that you feel most comfortable with. Western medicine, simpler, easier to understand. Chinese medicine, maybe if you have a good Chinese herbalist in your area who's been practicing for 20, 30 years, then this may be your best bet. Or an Ayurvedic one if you feel that your individual needs are very important, and you've had trouble with other herbalists who just gave an herb to you that didn't work for you individually. You may want to look for an Ayurvedic practitioner, and you can go online and look for them. There's many associations and groups and lists. They exist.
Kabir, in Western medicine, we're always looking and testing and doing studies, double blind. You hear of all the placebo-controlled cross analysis, and we're always looking for things that we practiced 2,000 years ago, and then we change things. An example would be we always thought that ulcers were due to people that were stressed out. So you're stressed, so let's give you an anti-anxiety medication that'll improve your ulcer. Then we found that it was a bacteria that was actually causing the ulcers. Does Ayurvedic medicine do any testing on itself? And is there any change in Ayurvedic practices from 5,000 years ago to today?
No, Ayurveda is really unchanging. It never, it's like in Western medicine, one theory can be quite dominant, like you mentioned, for a certain period of time, and then this is overturned with more scientific discovery at a later date. In Ayurveda, science is just slowly catching up with understanding why Ayurveda does the things they do. And in Ayurveda, they don't really concern themselves with the whys because they didn't have microscopes and the ability to look at things at a cellular level thousands of years ago. They just know that, for the Vata type, it doesn't have bowel movements, have 5 prunes soaked in water 2 times a day, 2 hours after a meal. Now, you may think, what? What the heck? This is strange. Or wake up in the morning and have a piece of dried ginger with a little Himalayan sea salt and chew it and let it sit under your tongue for 30 minutes in the morning. And Ayurveda doesn't really explain why. And they didn't really know why, I think. Only now science has started to catch up and understand on a nutritional level, on a scientific level, why these things work. And many things are still not proven. In the West, things have to be proven scientifically. In Ayurveda, they just know it works. You eat your 5 prunes soaked in water 2 hours after a meal 3 times a day, you're pooping. And whether it's because of the high potassium, the high magnesium, the timing in between the meals, these factors are not that critical. These are traditions and techniques and methods that have been passed down for thousands of years and are there because they work, not because they have to be completely understood. I remember in India in the 80s, the teachers, they didn't like you to question too much the whys, because even sometimes they don't know the whys. And I know many foods, for example, I never understood why. For example, watermelon is not recommended for the dry, dehydrated person. But all the other melons are. Honeydew and cantaloupe, they're very moist. They're not dry. You would think it should be perfect for somebody who's dry. But science now has determined that watermelon is very much a diuretic. And if you drink 1 cup of watermelon juice, you will urinate 2 cups. So Ayurveda seemed to have known this thousands of years ago and did not recommend watermelon for anybody who's dehydrated or the Vata type who has a tendency towards dehydration. They didn't say why. They just said it's not suitable for that type and that condition. And sometimes you just don't know why Ayurveda is thinking this. But science is slowly proving these Ayurvedic practices and techniques and understanding why they work. And of course, as you practice longer and longer, you can come to a greater understanding of why. But there's still many things I can't say why a particular treatment or practice works, but it was taught to me, and I've given it to my patients, and it works. And sometimes there are treatments that I would never take or have never done because they're not suitable for my body type. But the feedback from my clients is good. And it was taught to me, and this is the way it just goes. And I will teach my son the same method, and it's just a fact to Ayurveda. You do this you drink warm milk with cardamom and cumin and a little ginger at night, you will relax the nerves and sleep better. Maybe now Western medicine understands why, but again, Ayurveda was not that concerned about the why.
Clearly, there must be a different legal system in Ayurvedic practices. We're speaking with Kabir Southwick, a professional health consultant, an Ayurvedic and naturopathic practitioner. And Kabir, we're coming close to the end of the show. And as we traditionally do, one of our long ancient traditions is to ask for a health tip from our guest. And I wonder if you have something for us.
Oh, well, I always advocate a self-care, not looking outside yourself, whether it's to a medical doctor like yourself, there, and all due regard there, Glenn, or myself, an Ayurvedic practitioner, but to understand your own body, your own strengths and weaknesses, your own imbalances, and what foods, herbs, and approaches work best for you. So you are, in a sense, maintaining your own vehicle, not dependent on going to an outside person looking for answers or a cure, but understanding your own body. So healthcare, not healthcare, but self-care, learning to care for yourself. And if I could add to that, I always try to encourage my clients to think in terms of making progress with your health, not perfection. In Ayurveda, there's not so much, oh, you're sick and now you're cured. It's not that black and white. It's a matter of continually making progress to improve your health on a holistic level, helping with all of the areas that I mentioned here, sleeping, eating habits, digestion, lifestyle habits, and all of these aspects that can help improve your health, and to continue to work on these so your health is better and not deteriorating. And of course, this is increasing your longevity, and that's the real purpose of Ayurveda, is to live longer. And so there's really no cure in that sense. There's only progress, improvement.
I like that. Excellent health tip. I want to say to all of our listeners that Kabir Southwick has honored us with agreeing to come on a few more times and talk about a number of other topics with us. So we will be seeing and hearing from Kabir over the next few months and talking about many of the other things he does. I know he takes people on tours of food stores and talks about foods as they go through the aisles, teaching people many things about natural self-care. And so we're going to be talking with Kabir a number of times, and I look forward to that. In the meantime, we are grateful to our special guest, Kabir Southwick, for sharing his wisdom and expertise with us. I would also like to thank my teachers and healers for taking care of me and allowing me on my journey. Thank you to Yoga Hub and Christina and Segovia, and for all of you out there. And until next week, as we search another quadrant of the healthcare galaxy, I would like to wish you all optimal health. Thank you, Kabir.
Thank you for having me today. It was a pleasure.
Thank you so much, Kabir. This is really wonderful and educational, and we didn't quite get enough questions in there for you, so you might have to check the site for more.
I like questions.
Wonderful. They're coming. There wasn't enough time to squeeze them in. And of course, thank you so much. We look forward to having you back soon.
Thank you for having me.
And of course, we'd like to thank each and every one of you for joining us in this new platform of education and information. We're always grateful for your continuous support and look forward to hearing your feedback on how we can serve you better. We invite you to join us live on Tuesdays for Magical Medical Tour at 10:30 a.m. Pacific, 1:30 p.m. Eastern. Wednesdays for Trinity of Life at 11 a.m. Pacific, 2 p.m. Eastern, followed every other week with Flowing into Awareness with Anatara. And of course, you can connect with our wonderful Dr. Glenn Woolman by following him on Twitter at Glenn Woolman, and of course through his own site, glennwoolman.com, where you can learn about his Metaphor Square Breath. And please connect with our special guest today, Kabir Southwick, at naturalhealingohio.com, naturalhealingohio.com. Again, we are so grateful for all your continuous support, and we look forward to hearing your feedback or suggestions. Give us a call at 818-LETS-TALK, 818-LETS-TALK. Until next time, namaste. YHTV's Magical Medical Tour. Come join Dr. Glenn Woolman and Christina Suzama as they journey through the healthcare galaxy, interviewing doctors, healthcare practitioners in the attempt to share ways to achieve optimal health. Join us on yogahub.tv every Tuesday at 10:30 a.m. Pacific, 1:30 p.m. Eastern.
Brings you what you need when it wants, and you kind of have to open yourself to it. And a lot of times, I just say it out loud and say, this is what I would like to do, but I don't know. And so a friend of mine introduced me to it, and I started going in the last 3 years. So I've been overseas in the context of medical trips to Honduras, Panama, and this last year I went to Ghana